Right, so day one, DCA. I decided to do a little DCA trial myself, as it wasn't something that was available to me through clinical practice. It wasn't available through my doctors or consultants. It is something that has been researched in the EPICS trial, using DCA as a non-hormonal treatment for women with endometriosis. To date, all of the treatments have been hormonal based or surgery based that I've been offered. I've been through most of the hormonal treatments. They haven't been right for me. I had surgery back in early 2021. I had 2 fantastic years. It was brilliant. It made me realise how bad I actually was and how poor my quality of life had been up until that point. So obviously early 2023 or mid 2023, when all this started coming back, I was absolutely devastated and heartbroken to know that I was kind of back at the beginning of the process again, trying to find something that's going to help alleviate symptoms. I've tried a couple of new things through that time. I'm going to do a whole video on what I've tried, how it's affected me. Obviously it's all personal experience. This is what this is. It's a vlog about my personal experience with endometriosis and the things that I've tried, and going forward the things I'm trying as well. And at the moment the big focus is dichloroacetate, DCA. As I said, it has been used in trials, it has shown real promise in trials, but it's not licensed for use in endometriosis. It has been used for other conditions, including cancers, and it's shown improvements there. But because it's not licensed for endometriosis, I can't get hold of it through my doctor. I can't get hold of it through my consultant. Unfortunately, the answer's just been no everywhere. So I've managed to get hold of it directly from a lab, and I'm conducting my own clinical trial, as it were, using DCA to treat my endometriosis. The past week, it's probably worth noting that I am due on right now, like any minute now. So the pain has ramped up over the past week. It's been ranging from a lower end, kind of like niggly, it's always there pain, right up to curled up in a ball, not able to do anything, like a level 9 kind of pain. So it's ranged through the past week. My mood's not been great, obviously, because of the pain. I'm just exhausted all the time. My home life suffers. My relationship with my son. I have a wonderful 14-year-old son, and he is an absolute superstar, and does everything that he can to support me. I have an absolutely amazing partner who also does everything he can to support me. So I've got a lot of love around me, but it's very, very difficult when you're living with something like this. Hence the reason I'm exploring all these different options and possibly what some people might consider to be quite extreme ways. But yeah, the past week it's not been a good one, but it's been very normal for endometriosis. It's been very typical for that week leading up to my period. I keep track on Excel, and have done for a number of months, where I track daily my pain, my fatigue, my mood, where I am in my cycle. I track as much as I can, so I've got a solid base of evidence to compare where I was to where I'm hopefully going to be. But day one of the DCA, so I'm taking a lower dose for the first 2 weeks. I'm taking 333 milligram across a day, so split into 2 doses. That's 160 something, give or take, milligrams per dose. I'll take one in the morning and I'll take one in the evening. And that's obviously backed up by a number of supplements that I'll go through in a more in-depth video with DCA, what it is, the side effects, the supplements that help mitigate the side effects. So I'll go through all of that in a whole nother video. But the point is, today was day one, and straight out of the gate, there's no adverse effects. I haven't noticed feeling any different after taking it. I know some medications you can feel a little bit tweaky after taking them, but absolutely fine. No different to where I normally would be anyway. Pain wise, it's still been pretty normal. Fatigue wise, it's also been pretty normal. Obviously I'm kind of going into that phase of my cycle where I'm going to have my period in the next day, 2 days, give or take. So I'm expecting it to be painful. I'm not expecting the DCA to have done much as of yet. I'm really, really hoping, fingers crossed, that I'll do an update in a week's time and maybe I would have suffered a little bit less on the pain scale. I'm hoping, or maybe the week after, or even a month's time, even 3 months' time. You know, if there's any improvement, then obviously this will be a great thing. If there's not, then at least I've tried something. You know, try anything. So it really does. It affects women that have endometriosis will know how much of your life it affects. For those of you that might not have endometriosis or might have a partner with endometriosis, or you work with somebody with endometriosis, you might not fully understand the depth that it affects people's lives. And this is why there needs to be more research into this kind of thing. There needs to be more availability for different kinds of treatment for women with endometriosis. There needs to be a lot more surrounding this to help. So I'll do a full video about endometriosis, my personal journey with it as well, because it's been a long one. But yeah, so hopefully next week I'll update you, and fingers crossed might be feeling a little bit better. But this past week's been a little bit rough, just a bit.